Hey, it's Dr. Gonzo and you're watching In a Nutshell. Let's talk about normal aortic valve anatomy. When you look at the aortic valve from head on, this is what it looks like. It's a circle and something that looks like a Mercedes-Benz sign. The circle reflects what we term the annulus, and then each of the cusps has a particular designation. The non-coronary cusp, and the reason we call it a non-coronary cusp is that because there's not a coronary associated to it. The left coronary cusp, because the left main coronary artery comes off of it. And the right coronary cusp, because the right main coronary artery comes off of it. Now that's if you look at the valve head on. If you look at it from the side, it looks something like this. The valve pretty much kisses in the middle, or all three leaflets kiss in the middle. And these reflects each coronary cusp. Now you can imagine any pathology that affects the cusp or the aorta in which the valve is attached to can cause aortic valve disease. And that's normal aortic valve anatomy in a nutshell. Thanks for watching. I'll see you in the next one.